Good afternoon, everybody. Good afternoon once again. Shh. Good afternoon. I'm Steve Gregorian, President and CEO of the Detroit Economic Club. Shh. Thank you. Welcome to today's meeting. I hope your summer was terrific, and it's really good to be back together. We've got a lot of great programs coming up this season, so looking forward to that. 91 years of incredible speakers and networking, and that tradition continues today. So I especially want to welcome our DEC members, and if you're not a DEC member, just give me 5 seconds to convince you. Your next job, prospect, client, probably best friend is right here in this room. We'd love for you to join. You can do so at econclub.org. If you want to do so today, we'll sweeten the pot. Upstairs on your way out, we'll give you a free event ticket you can use through December. So we invite you to invest in you and join today. As we get started, I would just ask you to silence your cell phone so we don't disturb the program. We will, however, allow you to watch the Tigers game and yell out an update, if it's a good one. Exactly. All right, you've been with us before. You know we always begin with a pledge and a prayer, so I invite you to stand and join me first as we honor our country with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Kindly remain standing as our invocation today will be delivered by Brother Gary Wegner, Executive Director of the Capuchin Soup Kitchen. Brother?
Thank you, Steve. First off, Bob, I really am going to keep my promise to my doctor at Henry Ford. I will get that knee surgery. Doctors are used to promises. In Psalm 147, verse 3, we pray, God heals the brokenhearted and binds up their wounds. God of healing, God of wholeness, we pray for any among us whose hearts may be broken by poor health, sickness, or pain, their own or the illness of a loved one. We pray, Lord, that if it is your will, they might be restored to good health and holy joy. We pray, Lord, for doctors, nurses, and all who glorify you through the healing arts. Give them ears that are open to listen to those who seek their help, hands that are sure and steady when they diagnose, treat, or operate, and hearts filled with compassion for the fearful and the suffering. Above all, send each medical professional the wisdom they need to serve the sick, comfort the dying, and trust in the gifts of their colleagues. We pray, Lord, for psychologists and counselors who tend to the mind, social workers who strive to build, strengthen, or repair support systems, and chaplains who accompany patients and families as they walk through the valley of death or voice questions that have no sure answers. We are grateful for the miracles of modern medicine, the vaccines that prevent serious illness, the medications that treat the previously untreatable, and instruments that help bodies heal. We are grateful for the scientists, engineers, and technicians who are dedicated to finding cures or offering hope. Bless the administrators who oversee the complex medical institutions upon which we rely, the insurers who at their best give us peace of mind, and legislators and public officials who make the laws that guide our medical systems. May all who seek to serve the sick and the wounded remember the poor and the forgotten, who often live on the margins of our healthcare system, indeed of society, and may lack full access to the benefits of modern medicine. Detroit's own saint, Blessed Solanus Casey, believed that gratitude is the first sign of a thinking, rational creature. May we always be grateful for good health, for good food, and for all who are gathered here. Amen. Thank you.
Please be seated. Brother Gary, you know, there's a lot of physicians and healthcare professionals. You want to do that knee surgery? They're here in the room. We can do it right now for you if you want to get it done right now. All right. A couple of thank yous. I want to say thank you to WDIV, Local 4, for live streaming today's meeting, and also to WJR, who's doing their focus show live right outside the room. All right, if you've been with us before, you know students are important to us. They're here today and always, courtesy of our generous corporate sponsors. Their morning already included a private student-only reception. Let me tell you who is in the room with us today. We got students from St. Catherine Academy, sponsored by Kendra and Accenture. The mighty Seaholm High School Maples, thanks to Naveen and Boston Consulting Group. Schoolcraft College, thanks to Tina Freese Decker and Corewell Health. Wayne State University School of Medicine, thanks to Bob and the Henry Ford Health Team. And University of Windsor, thank you, Tony and Fifth Third Bank. How about a round of applause to welcome the students? Super quick moment, never lost on us. We have to take time to thank our generous corporate sponsors. Take a look at the brochure on your table. We would not be able to do programs like we do if it wasn't for your generosity. So thank you. If you're interested in becoming a sponsor, we'd love to talk to you. There's some terrific benefits. Also on your table, our season lineup. Lots of programs starting to pop onto the schedule. Two in particular in the month of October I want to call your attention to. Mid-October on the 15th, if you're a Pistons fan, and they had a great playoff run last year, their leadership will be with us to talk about their resurgence and looking ahead to the brand new season. That'll be President Trajan Langdon, Head Coach J.B. Bickerstaff, Vice Chair Arn Tellem. So along with Special K, everybody's favorite Special K, Greg Kelser. October 30th, just announced, we'll be hosting our City of Detroit mayoral candidates, Mary Sheffield and Reverend Kinlock. That's a big deal to get those both in the same room. Trust me, you won't want to miss that. Get your tickets. That's October 30th. And of course, more meeting announcements coming your way. All right, 91 years of speakers, 91 years, and those speakers tell the history of our country. So Tina, Bob, and Eric, you and I join a distinguished list of 13 other speakers who on this day, October 1st, graced our stage. And there happens to be some very impressive political names on October 1st, including 1956 Michigan's Governor G. Menon Williams, 1979 October 1st at the DEC, a U.S. Senator from Kansas, Bob Dole, and this one's big, 1984 on our stage, President of the United States, Ronald Reagan. Now, I bet he didn't take 3 hours like other president recently did, but who's counting anyways? So today, we're pleased to add Tina, Bob, and Eric as our 14th, 15th, and 16th speakers on this day in DEC history. So congrats, and thank you for doing this for us. Finally, we want you to use your smartphone so you can participate in today's program, take a lot of pictures, share with your social media networks, and you can also submit a question for our panel using the QR code on your table. And those questions are going to make their way to our presiding officer, who I'm going to put to work. Naveen Awad is the managing director and partner of Boston Consulting Group here in Michigan. She's an amazing supporter and board member of the Detroit Economic Club. Ladies and gentlemen, please welcome Naveen.
Thank you, Steve. Good afternoon, DEC members and guests, and of course, go Tigers. It's my pleasure to introduce today's esteemed guests. First is Tina Freese Decker, who is the president and CEO of Corewell Health. Corewell is actually the largest employer in the state of Michigan with over 65,000 employees. Tina was really key in architecting the integration in 2022 of Beaumont Health and Spectrum Health, which are now unified under the Corewell Health brand, which also includes Priority Health. Tina started as an intern at Spectrum Health and worked her way up. She holds undergraduate degree in finance from Iowa State University and a master's in management and industrial engineering from the University of Iowa. She serves on many boards and adds a lot of value as also a board member of the DEC. I'm going to have them all come up at the same time. I guess I'm a little shorter than Steve, so I have to move up the microphone. Eric Langshur is the founder and managing partner of Abundant Venture Partners, a purpose-based incubator focusing on improving the human condition by creating companies that improve human wellness, performance, and engagement. Eric has founded 12 separate companies in this space and is also the founder and executive chairman of AVIA, a leading healthcare innovation network. Eric holds a Bachelor in Business Administration from the University of New Brunswick and an MBA from Columbia Business School. Finally, Bob Riney is the president and CEO of Henry Ford Health. Bob has more than 45 years of service at Henry Ford Health, and he is playing a pivotal role in his organization's current era of unprecedented growth, and we're all very excited about Destination Grand. Bob is a graduate of Wayne State and serves on numerous boards. He chairs the Detroit Regional Partnership and the Parade Company, and is a valued member of the DEC board. So if you could all please come up. Our moderator today is Robin Erb, Senior Health Reporter at Bridge, Michigan. Robin covers a range of health issues in Michigan. She received her undergraduate degree from Miami University and her master's from Lourdes University. And then please come on up, Robin, and I'll let you take it away.
Thank you. Hello, hello. Oh, goodness.
Oh, now your mic dropped.
I am. Oh, no.
This way.
I told my husband I would make a fool of myself today, so there you go. So I think, you know, there's always great plans in business, and reporters are no different. You have a plan for the things you want to ask, and then somebody will mess them up. And yesterday, it was Congress. So we're going to start there. So I'm going to forget these questions, and let's start with the government shutdown today. So much of it is about healthcare. So let's open it up there. Tell us what's on your mind today about this, and do you have any insights or any predictions on what's going to happen here?
Well,
Insights and predictions?
been really nice seeing all of you. I would say a couple things. One is obviously, we are worried about ongoing ambiguity, because ambiguity for the business community and for the insurer community and for citizens is just not a healthy thing. And when you're making a lot of investments, that ambiguity makes people nervous. It makes people that are philanthropically minded nervous about what's going to happen and what's the impact. So I would start off with just some comments about the danger of prolonged ambiguity. On the specifics of the impasse, I'm actually frustrated that it's about healthcare, that the richest country in the world and lagging most developed countries in providing basic insurance of one form or another for its citizens is what we're fighting about. And the reduction of insured individuals does not save anyone any money. I mean, let's be really clear on that. It does not save, and that's not a political statement, it's just a math fact. And because the reality is we have an obligation to provide care. So people will show up in the ER like the old days, which is the most expensive portal. It's not a portal that's conducive for proactive care. It's very much reactive care. And ultimately, I hope Congress embraces the fact that you can't solve one problem by creating two. You've got to actually solve a problem if we really want to get at it. And I'm hoping they'll come to that conclusion.
I think healthcare is an area that needs significant transformation. And we can't be comfortable with the incrementalism that's existed. And so what's happening is all the patches that have occurred to keep healthcare where it is today, they are being removed right now. And some of those patches should be shouldn't be patches, but we have to figure out how to provide health care to our country in a more affordable way, in a simpler way, in an equitable way, and high experience. And so the challenge is, when everything's coming off, how do we do that in a couple years? That transformation is going to take 10 plus years. And so we need the time to be able to drive that forward. And we also need to have the engagement from all the different players, part of the ecosystem, as well as community, to say this is where we want to go in the future and what we want to achieve. But just stopping things will then go to less preventive care and more ER utilization, which will drive the cost up. And so I think we have to be less transactional and more transformational to figure out what do we want to accomplish and put those into place. And they're going to be hard, bold decisions that we're going to do to change and transform healthcare, but let's do that and move it forward so we have a healthcare system that works for all the people in this country in 2035 and 2065, especially when we could be celebrating 100 years for Medicare and Medicaid in 2065.
And I just want to add one quick comment. The healthcare industry, both individual health systems and the industry as a whole, has made it very clear to both parties that that is the role we want to play. We want to sit at a table and reconstruct and transform the industry. This isn't the way to do it.
It's great context.
And I love both those perspectives. And I would just add, as if we zoom way out, that I think this is an opportunity for us to look in the mirror as citizens in this country and think about the discourse that's happening between these two Americas and our role in it. And, you know, if we can't in our communities find middle ground with, you know, the people that really matter to us in the day-to-day living of our lives, it's not surprising that we're getting this, this outcome from our elected officials.
Eric, I'm glad you brought that up because I think that we need more humanity and civility.
Yeah.
Bob and I see this all the time in our hospitals with the violence against our healthcare workers. And we have legislative proposals to help protect our healthcare workers. But we need that from all of us, to really embrace that humanity and that civility and model it and expect it and be willing to listen and engage with others, even if they have different opinions, and then come together to find a solution. I think that's critical for us to move forward.
Thank you. I remember doing a story in the middle of the pandemic on one of the Beaumont doctors and what he faced in the clinic rooms and what he faced from patients. And even as a health writer who's been doing this for many years, I was astonished at how much grief he took. But let's go back to what we're supposed to be talking about here today, innovation and new things in healthcare. And I think on top of everyone's mind is AI. I mean, that seems to be what everybody talks about when we're talking about new things in any industry right now. So let's talk a little bit about how AI is being used in healthcare. And Bob, you and I talked about this a while ago, like the ethical considerations and the business considerations.
You know, I think AI is, first of all, it's not new to healthcare, and that's important to note, but it is advancing at a pretty significant rate. And it falls in a lot of buckets. And on the clinical front, you know, the example I would give is, you know, we have now the first in Michigan, we were developed an advanced deep brain simulation that in essence is a pacemaker for your brain for Parkinson's disease management, and Parkinson's is soaring. That's an AI-based advancement. And on the side that I think consumers really care about is how do we make healthcare easier to access, easier to understand, and how do we make sure that the role between the patient and the physician and the nurse is enriching. There's a lot of things that AI can do, and one of them is using a portal to make sure that you as a patient are doing all the administrative stuff in advance of the clinical visit so that the clinical visit is really meaningful. And what I mean by that is, you know, going online, first getting some choice of when your appointment you want or when the test you want. Just like you would do with an airline or anything else. Secondly, it's going through and you reconcile your pharmaceutical list and you request if anything is no longer something you're taking. It also allows you to, if there's a copay through your insurance, to pay for that in advance in an easy way using credit cards, Apple Pay, anything that you can think of. It also allows you to choose in advance the pharmaceutical location that you want a prescription to be immediately sent to while you're still in the doctor's office. And most importantly, let's say you're dealing with a clinical issue and you're in a degree of pain, but it's 4 weeks out for an appointment. It will allow you to authorize text messages sent to you anytime there is a cancellation, an opening, or a change at any location, so you can say, I will take that one in 2 days versus the one I have scheduled. So that's a snippet of AI-infused consumer-based tools that I think are not only transformational, but they're things that we've become so used to in other industries, we wouldn't think of doing it any other way.
In addition to what Bob said, I think there's a couple areas where we're using AI and everything that kind of goes with AI, the technology that goes around that, the algorithm process. And so it can be back office functions where you can be 5 to 10 times more efficient, but also applying the AI, the algorithms to data so we can better predict when you have chronic disease, when you should leave the hospital, leave the ICU, when things may be trending upwards that we need to do something differently if you're in the hospital, and we can better correct that so that we can keep you safe and healthier. And so there's a lot of things that we're doing in that area. There's also areas where we are augmenting what we do as humans. So, for example, we have tug robots, and they have names, and they roam around some of our hospitals, and they take the patient food trays from the cafeteria to the patient rooms. That way, one of our team members doesn't have to lug that cart throughout the hospital, because if anyone's walked through the halls of our hospitals, it's miles sometimes. And you can actually personally deliver the tray and make sure it's the right, low-salt diet that they're supposed to have, and ensure that they have everything, and provide that human-to-human interaction. And then there's things that we're doing, like what Bob said for neuro, virtual reality, thinking about how do you take 2D CT images, put them in 3D, and see it through glasses on a patient's brain to see where are the blood vessels and where do I need to make sure that I target the scalpel to and not. That is truly amazing of what we can do as we move forward. And so I think that AI is an area that's going to augment us and our technology and allow humans to do what they need to do best.
One thing that I would just add to this conversation about innovation that we probably don't pause and recognize as much as the advancements in pharmacology and the impact it's had on quality of life in patients. And part of it is because we're in a real dilemma about the cost of pharmaceuticals, and it's a very legitimate issue that we have to figure out. But the advancements in that space and what it has done to improve health is something that is quite substantial. Going back to how quickly we were able to create vaccines for COVID that stopped what was a horrible trajectory and turned it into a manageable disease overall. So the role of pharmacology and innovation is really a part of this ecosystem.
Imagine. Yeah, I think you had mentioned something about microdosing in cancer treatment, and
It's truly incredible some of the things that we're able to do, some of the new procedures that we can have. So there are new medicines that are coming together, just thinking about how do we create those medicines with artificial intelligence and robotics. There's some new procedures where, again, surgery, most of you are done eating, used to be like a blood sport, right? You would open someone's chest, there'd be a lot of blood there. Now, we can do some of those procedures with just one port or 4 ports the size of your pinky. And in some cases, we don't even have to enter your body. We can use ultrasound waves that are heated up to like 52, 58 degrees Celsius to really burn through and liquefy some cancers. We can target areas in your brain so we can remove the essential tremor so people can can write, they can hold a cup of coffee and drink from it. I mean, we are doing game-changing things that allow people to live a high quality of life as they go forward with that. It's truly incredible. And I do think that part of this is the great work our physicians and our clinicians and our team members are doing within our organization. It's also the research that's being done with many of the organizations. You know, we have partnerships with MSU, as you do. We have partners with Oakland University, with Wayne State. There's so many great things that are being done in developing that research. We had one where we had a syndrome that was named after two researchers, one from Corewell Health and one from MSU. And because of their work, they found this rare treatment for a little girl named Marley that is now can walk. She couldn't walk before. She's now growing hair on her head. And we are now treating 20 people across the world because of this finding. And it was because two of our physicians got together and said, what about, and how do we solve that? And just imagine if we can use all of that with AI and data, those discoveries are going to come even more. And we're really excited about that.
Yeah, you had me at growing hair on your head.
Well, Bob, I wasn't sure when Robin asked about microdosing, I wasn't sure where this conversation was going. You know, I think what I'm hearing in sort of the music of these important notes is the speed with which technology is changing. Like, we are living in a moment where I think the history books are going to look back at today and say, you know, this was really in the history of humanity the most influential moment of change that we've ever seen. And what's interesting, especially to me, is how that change is playing out in slow motion in front of our eyes and actually in fast motion. So consider this, because this change is happening on an exponential curve, and we have trouble understanding exponential growth. So everybody just look around the room and imagine taking 50 steps across the room. You know, we understand what linear looks like. But exponential growth is hard to compute. So if we were to take a piece of paper and fold it 50 times, and then that 51st fold, we shoot past the sun in terms of distance. So it's the change, the transformation. I loved your line about really pointing to transformation. Requires all of us to get our minds around this change. So consider this, in 1700, and this is the Detroit Economic Club, so this might be interesting to you, the GDP of the world grew at 8% a century, up to 1700. And I just finished reading the Isaacson Ben Franklin biography, which was amazing. Franklin was born in 1706, really at the dawn of the Industrial Revolution. From 1700 to today, that growth has been 350% a century. So if you're Franklin looking from 8% to 350%, it doesn't make sense because history doesn't support that. Now we're talking about a 20% annual abundance dividend through these technologies. So 20% a year for 100 years, if the world economy is $116 trillion, 100 years from now, it's 9.6 quintillion. That's like one with 18 zeros. I mean, it's mind-boggling speed. So, two, there's a new organism that is being birthed that you guys, as managers of really complex entities, now have to deal with, which is, the AI agents. So, in the past, we think about the big inventions, fire, the atom bomb, the internet, the printing press. Those were all tools that man was, in control of. But today we have a technology that reads, writes, speaks every language, remembers everything, analyzes, computes, does math, codes, thinks creatively, draws, makes movies, makes hotel room reservations, right? And then acts independently. And it's that acting independently piece of this which has seismic implications for us. And so, you know, we all need to think about this transformation as a big change management puzzle, which includes how do we bring human resources into this room. And Bob, I know you spent the first big chunk of your career in HR. I mean, the role of HR as we all learn to reskill ourselves is especially important. And then the last thing I would say on this kind of the speed piece of this, you know, consider the cost of cognition. Information has gone to zero. Like everything that we know is available to everyone, everywhere, and every moment for like near zero cost. Like what does that mean for society? So, you know, in physics, there's this concept of the event horizon around a black hole where light doesn't escape. We're sort of in the business world. I think we're at a cognitive event horizon because there's so much data now that's being created. It's just, you know, it's accelerating and it's chaotic that we can't use traditional means of managing information and managing that data. So we need this new set of technologies as an interface layer to navigate the world, to translate the world as a thought partner. And so, you know, the transformation work is transforming. And it's a big, big, heavy lift for all of us. I'll maybe end with this. You know, I began my career, I'm 62, with this view that I was going to learn a set of skills, and then I was going to apply them and then retire. And that compact has completely changed. I mean, I need to reskill. We all need to reskill, and going to need to reskill for the rest of my working days. And that, you know, makes me anxious.
You know, Eric, you said a lot of really powerful things. I think the challenges are great, but I think it starts with guiding principles or values that you're not willing to compromise on. And I think for us in healthcare, AI can and should advance us to levels we can't even comprehend, but we should hold sacred the power of human touch. And the fact that human touch, and there's research to support this, helps healing. It helps lower blood pressure. It helps lower anxiety. It increases the likelihood that there's not going to be a repeat admission or a prolonged length of stay. And AI can do an amazing amount of things, but we've got to use it in a way so that the actual human touch of our caregivers is greater, not less, and can be used in a different thing. And I think you have to start with commitments around that, or it can take a life of its own, and you lose it.
Hear, hear.
And in addition to that, we are I don't want all of you to be scared that we're just putting all of AI in. We have governance structures around AI because we take very seriously your health and all of our patients' lives and the data that you give to us about you, and making sure that we use that in a safe and secure and smart way. And when we do deploy technology or AI in that way, we want to do it in a way that builds the trust and helps us get to where we are and provides that great care from a human perspective.
Let's talk about that data. I mean, every bit of our healthcare information now is on an EMR somewhere, and we're hearing all about data breaches and, oh gosh, ransom attacks and all of these things. Tell me a little bit about, like, what keeps you up at night, and how are you preparing for something like what happened at Ascension, last year, the year before, with that giant attack?
We just did a session where we got all of our business areas together, clinical areas together, and planned for what would happen, not just if we were down one day, but if we were down 30 days. And how would we make sure that we could still provide care to our community? And there's so many things connected now. I mean, even the oven is connected, so how do you make food for your patients? But that sort of planning and going to that level and having the diligence and in the process of doing that is really helpful to do. So we take very seriously the safety and security of the data, but we also know that we need to make sure that we can respond well with 65,000 people plus all of the partners when something like that happens, to make sure that we can continue to care for people in our community. And so it's critical. I would just encourage all of you to think about, how do you protect your data? There's so many places out there that ask for your information, and we really don't know how they're using it, especially as AI is coming out. If we put something in ChatGPT, it is out there. And so it's really understanding those pieces and having yourself a desire to protect your data and helping us protect your data too.
Yeah, we are doing very similar kind of training and simulation exercises and real-time tests. I completely agree that this is a partnership. Health systems can do everything they can, but consumers have to do everything they can to protect their own portals of entry. But to the point that you raised, when Ascension had their big national breach, and we were in the process of having the Ascension Southeast Michigan facilities become part of Henry Ford Health. So we were obviously very, very closely monitoring, and something was discovered that's no surprise. And what they said is, the longer term, more senior nurses and physicians that grew up in a paper environment, they said, we got this. And they immediately kicked into gear. But the new nurses and physicians, that the only thing they know and the only thing they knew was the electronic medical record, felt a lot more handicapped and a lot more paralyzed. And I think there's some lessons about that as we transition to all sorts of technology, that we don't lose the skills of very much needed backup enterprises, because we are going to need them at different times.
Bobby, and I've just read for the first time this term unskill. Has anybody heard the term unskill? It's exactly that.
Yeah.
We're in such a strange time right now, as you've mentioned. There's so much confusion about healthcare. We were talking Medicaid cuts that might be coming, insurance upheaval, just so much. I'm wondering how does AI or any of these other innovations, do they help, do they hurt, do they make a difference? And I'm thinking really right now about the confusion over healthcare. I mean, people trying to sort through what's real in public health information.
I'm going to go back to something Tina said earlier. I think they're not going to create great affordability change or great value change unless we are willing to take a holistic, transformative look at the industry. Because if we're just attacking a patch here or a patch there, or fragmentation, and that's why personally I'm such a believer in the concept of the term value-based care, population health. And while there's a lot of controversy around it, at the end of the day, it's about organizing care and having a partnership with patients that helps them learn to proactively take care of their health. It forces us to think about spending dollars prevention versus reaction. And it's something that people agree with, but there are so many entrenched root guards to the status quo, to the current system, from healthcare delivery, insurance, secondary supporters and vendors. I mean, and it's such a big deal that it's gonna take a different approach than we've been able to do in the past to say, what is the best way to organize care? And I mean care in the broadest sense of that definition for this country. That takes will. That takes great political will.
Yeah.
I think one area that it could really help is health literacy. Mm-hmm. So, we don't have great health literacy. We don't, as a country, as a society, we don't follow through on the things that we need to do to be healthier. And so there's ways we can use the data that we have to query, I have this, what would be the solution? How do I just think about the questions I should be asking and do it in a way that is a patient, consumer-centric, human-centric question, so you can have that dialogue with clinicians about what you do, and then put a plan in place that's doable. And I think we have all of this data. Let's use that so we can really impact chronic disease, we can focus on prevention, and we can drive down the total cost of care and actually increase each of our health.
Yeah.
And the good news is we have to do it. We have an aging population. We don't have the workforce. You know, we have no choice but to substitute capital for labor. You guys probably spend 50 to 60% of your total P&L on labor.
Yeah.
And here's some, I mean, with all due respect, right, our industry has a labor addiction. Like, we are addicted to labor. The last 2 years, the big 7 tech companies created $12 trillion of market cap value, and they hired 20,000 people. In that same period, hospitals in this country hired 1.3 million people. 20% annual turnover, 19% open jobs, 15% open nursing jobs. Like, you know, when I got into healthcare, we were saying it's 12% of the economy. It's unsustainable. Right, where are we now?
18, 19.
Right.
So what's the prescription here?
Well, at what point do we, you know, we can't afford to pay more?
We have yellow numbers that are telling us we're running out of time. So in the few minutes left, I want to ask each of you, what do you think is the biggest misconception in healthcare? What is something that you want to straighten up?
You know, I could give you a dozen misconceptions, but I'll start with one. You know, healthcare in this country has described as too expensive, too inflexible, and not delivering value compared to other countries. And I think you will find both Tina and I are up here to say that healthcare affordability is a very, very important issue that we are working hard to infuse technology to advance, and to your point about the availability of workforce. So no question about that. But we also have to start with truth seeking so we understand the issues, because we have to own our own stuff if we're going to really advance. And so one of the things that irritates me that I don't talk a lot about is that, you know, a lot of economists like to float these charts that say U.S. healthcare, you know, here's the mortality rates compared to other developed countries, and here's the cost of care. And the cost of care is a challenge, but the wage structure in this country is so totally different in all industries compared to many other countries. So you just need to know that, because it's ultimately about making choices. But the one that irks me is if you take gun, death violence, and suicides, which are uniquely US problems, off of that mortality chart and compare to the rest of the world, we look very differently. And that's a mirror we need to hold up and own, regardless of what you think. Suicides and gun violence, in comparison to other countries in the world, is dramatically unique to this country. And that's not a political statement, that's a public health statement of where we place in charts that like to be used that aren't accurate.
I have 2 things to add. One, when Steve asked us to speak, he said, "Are you and Bob friends?" And I said, "Yes, we actually are."
Yeah, we are.
And so in healthcare, we compete and we
dress in the same colors
Here
every
we
day.
go. So we compete and we collaborate, and we do a lot together because we know that it's about how do we work together to take care of a community. So I think it's really important that for healthcare, it is something that we all call each other to say, how do we do it better? But the big thing that I think we need to talk about is in this country, we have amazing innovation. There has been so much progress, as Eric commented on, about where we've moved from open surgeries to laparoscopic to robotic to non-invasive and process. We have moved people from inpatient care to outpatient care. We have helped people stay alive far longer because of the surgeries, the medications, the treatments that are happening. But we haven't valued what that is. And it could be because we typically put a $20 copay on something. The person sitting in front of you as a physician or a clinician has gone through 4 years of medical school, 3+ years of residency or fellowship program. I mean, they're experts, to your point about cognition. And we need to make sure we're embracing them with the new skills.
And $500,000 in debt.
Yeah. With the new skills and the technology, of their critical thinking skills of how do they navigate that. and make sure that we value what they're bringing and help the healthcare system embrace that as we transform to something better.
And you know, it's inspirational for me to hear you too, because you know, we all attend a lot of talks and panels, and you are both so real and honest about naming the problems. And you know, a lot of CEOs get up on stage and say, look at all these great things we're doing. And there's so many great things happening, and it's really complicated work. And you both have complicated jobs. And the other thing that, and it's an answer to your question, that inspires me is what also emerges is the humanity of the work that you're presiding over. That this is, you know, the most important good and service that we'll ever consume in our lives and our families. And it matters so much, and the well-being of the healthcare delivery system in this country matters so much to rural America, to inner city America, to access to the underprivileged. And so, you know, I always hear that coming from you guys, and that's why I'm here, because it's very cool.
I feel like maybe you guys could help Congress get out of this mess right now.
They can.
If only they would listen.
Right.
Thank you, everyone. I think we're
Yeah, we have lots.
now, and thank you so much. Thank you for the question. You want me to step down?
All right, so we got a lot of audience questions. I'm going to give one to each of you, just given we ate into some of the time. So, Eric, I will start with you. So, you founded multiple health-related companies. What patterns have you observed that separate innovations that succeed versus fail?
You got to have a customer who's going to use it. Workflow in these health systems is incredibly complicated. And this whole idea of, we'll just have the nurse do it, or just have the doctor do it. The playing field is littered with dead carcasses who made that assumption. You've got to have a payment mechanism that's clear so that there's reimbursement, otherwise it's not going to happen. And then, of course, the talent equation is always right at the top of the list. And I guess the last thing I would say is, everything that we do with people who bring just a partnership mentality. This work is so hard. The delivery system in this country is fragmented, and we've got to work together. We just have to work together, because we don't have the time or the resources to do it independently.
Excellent. Tina, what have been your key learnings in integrating two large health systems?
Well, we learned a lot as we did the integration between Spectrum Health and Beaumont Health to create Corewell Health. I think that some of the key learnings are communication, over-communicate and over-listen. You just cannot do enough of that, so that's really important. I'd say move fast. We moved really fast to put our system on one electronic medical record in 2.5 years, and I'm so glad that we did that and we're done with that. Because we're now seeing the fruits of that come together, where we're all kind of standard approaches and things, and we're seeing the quality scores continue to increase. And it's in the innovation coming through, the conversations that enables between all parts of the system to figure out these transformational things that we need to do. So I'd say move fast and be okay with making some mistakes and then asking for forgiveness and grace and coming back and fixing them after you do that. So it's just moving forward, and I think we've done a good job with that, and I love to see the results so far.
Great. Bob, how has your relationship with MSU evolved over time? And what do you think it will look like in the next 5, 10, 20 years?
Well, our relationship with MSU is a 30-year partnership, but we anticipate that it will go on further than that. And no, I will not still be working at the end of that contract. But I think that short term, we are providing additional really good academic sites for training for MSU grads. We are also building a 400,000 square foot joint research building in the city of Detroit near our flagship hospital that is designed to bring the scientists of both MSU and Henry Ford Health together for discovery of things that have an immediate ability to transfer to patient care and to make precision medicine really work and flourish, things that will improve lives, not research for research's sake. And we've got an incredible physician and scientist team that are dedicated to that. Beyond that, the nursing school and creating partnerships with the nursing school is off to a great start. And this is not just about recruitment. Even with nursing, this is about research and innovation and transforming the way things are done. And talking to what Eric Schultz mentioned, you know, we all have simulation labs in our organizations. We now have the ability to train and be part of the academic programs of nursing schools and others, so that the leap between graduation and all of a sudden being confronted with a host of complex patients isn't so scary. There's a lot of additional things that we have planned with MSU. I've always been, you know, jealous that Michigan has a marching band, and now, you know, we're going to match them for that. But the excitement between MSU and Henry Ford really lies around advancing Detroit and the Detroit area from an economic standpoint and discovery and research.
That's great. For all of you, if you could reimagine one aspect of healthcare delivery, what would you change and how?
If we could reimagine it, I would say that we can be faster to help diagnose and figure it out so that people don't need as much health care as we provide. I think further upstream process, enabling the conversations to happen there so that we can improve and you can stay healthier.
I would, maybe a similar answer, if I could reimagine, I would have individuals have both a physician that they work with as a partner in all stages of their life and a health coach. And whether that health coach was through automation or an individual, but someone that can really help them on that journey in partnership, because that would change the downstream activity in a very significant way.
Yeah, and we are reimagining it, and you know, we think about it through the lens of if we can make the clinicians, the doctors and nurses' lives better, and that's going to translate into, you know, more time and more engagement with patients. And then if we can improve the patient experience from, you know, even before they're patients, of course, with education and you know, the outcomes of both those things would be remarkable.
Thank you, guys. All right, we're going to move to the lightning round, audience favorite. So I have 4 fun questions. The first one I'll start with is, what is something on your bucket list?
For me, there are a couple of parts of the world that I haven't had the chance to discover, and I'm a world traveler. I love travel. I think it's the greatest education. So probably next on my bucket list is Vietnam and Cambodia.
Oh.
I'm all about family experiences right now because I have a senior and a sophomore in high school and taking as much time I can with them. So I'd like to take them to a Lions game.
Oh, a winning Lions game.
Winning Lions game.
Thank you for the coach. We were just in Iceland on vacation, and we missed an active volcano by that much. So I really want to see a volcano erupt.
You have to be a certain distance? Okay, now how about something on your anti-bucket list, something you will never do again?
I would never go cave spelunking again without harnesses.
Oh.
That was enough.
I will never bicycle ride next to the queue line tracks because my bike locked in and I ended up spending a week in ICU.
And when we were in Iceland, we went ice climbing, and I will never go ice climbing again. Okay.
Please finish this sentence. I wish I was better at blank.
I didn't hear the question.
I wish I was better at
Singing, it's coming in my next lifetime.
Yeah, I'd like to be better at singing too.
I'd like to be better at tennis. Both my kids are varsity tennis players, and I'm a great cheerleader, but I'd like to be able to play with them.
I wish I was better at pickleball.
Our orthopedic department thanks all of you for playing pickleball.
What was your first car?
I had a Chrysler New Yorker. It talked to me. Told me my door was ajar.
Picture this, Ford Pinto.
Oh! What color? What color, Bob?
Oh, gold. Ish.
1972 Pontiac Le Mans.
Ooh.
Weren't you fancy?
Okay, what would you give as advice to your 25-year-old self?
I'd say be curious and be courageous. Be bold about what you want to try to do, and go out in the world and make a difference.
Hang with people smarter than you.
I would say relax, it's all going to be okay.
Thank you guys very much.
All right, Tina, Bob, Eric, you guys were terrific. Let's take that show on the road somewhere. You guys are fantastic. Thank you so much for being with us. And Naveen and Robin, you played very important roles, and you did them so perfectly. So thank you. One last round of applause for everybody on stage. You all can play a role in helping out the DEC. Tell your friends and family to join the club. We're a really cool group of people, and I love to say it on time every time. This meeting of the Detroit Economic Club is now adjourned. Thank you.